Good evening, sir. My name is Kate. I'm the nurse practitioner that's going to be completing your abdominal assessment today. How are you doing?
I'm good, thank you.
All right, and so we are going to get started with this assessment. I'm going to have you just pull your shirt up if you wouldn't mind.
Sure.
And the first thing that we're doing here is we are inspecting the abdomen. And so we are taking a look for any abnormal venous return patterns, which I don't see any. We're looking for any obvious distension or asymmetry. Again, I'm not seeing anything abnormal there. I am noting a small bulge there right inside your umbilicus, likely an umbilical hernia, but otherwise nothing abnormal just from an inspection standpoint. We are going to move on then to auscultation, as we move on to auscultation, we are going to do so in a pattern that moves from the right lower quadrant to the right upper quadrant, the left upper quadrant, and the left lower quadrant. So first I'm just listening for bowel sounds, so I'm going to use the diaphragm of my stethoscope for that. Your bowel sounds normal there. What I would expect to hear is between 5 and 30 or 35 sounds per minute, and you're well within that range. And now I'm going to move on to listening for bruits in the abdominal aorta and a few of its branches. So we're going to start with the aorta, which is a bit above the umbilicus here, with the bell of my stethoscope this time. And if you would mind holding your breath for this part. Okay, and breathe. And then we're going to move on to the renal and then iliac branches, and we're going to do that on both sides. So I'm sorry, I'm going to ask you to hold your breath one more time here. And go ahead and breathe, and I'll move on to the other side. And then last but not least, I'm going to do the femoral branches. You can breathe normally for this part, and in order to maintain your modesty, I'm not going to actually pull your pants down here, but okay, great. Now, interestingly, when you were holding your breath there, I was actually able to notice some aortic pulsations, which I didn't notice whenever you were breathing before, but I could see those, and that's perfectly normal for some patients. So I could see those when you were holding your breath. We are going to move on to percussion and then palpation. So first I'm going to percuss in all 4 quadrants again. We expect to hear tympanic sounds here because mostly you have a lot of air in your intestines and in your abdomen there. So again, in the right lower quadrant, in the right upper quadrant, the left upper quadrant, and the left lower quadrant, and that sounds tympanic throughout there. We can move on to percussing to look for the border of your liver. And so in order to do that, I'm going to start lateral to your umbilicus and work my way upward, listening for the sound to go from tympanic sounding to dull sounding. And when I hear the switch there, that indicates that I've met the lower border of your liver. And I hear that right there. So I'm noting that that demarcation, and then I'm going to start working downward from about your 5th intercostal space in the intercostal spaces. Again, listening for dullness to indicate the upper margin of the liver, which is right there. And then I'm going to take my handy dandy stethoscope that also has a tape measure on it and measure the distance there, which is about 8 centimeters, which is within the normal range of 5 to 12 centimeters. And so that's indicating you're measuring the breadth of your liver. And then we will move on and see if we are able to use percussion to find the spleen. We don't expect to find it per se, but we don't want to move with that assumption because then it's possible that we might miss an enlarged spleen. So we're going to, now the spleen generally lives up underneath your ribs, so we're going to start here and kind of work our way upward. And if you could take a deep breath in and hold it. Okay, thank you very much, sir. So I didn't find any dullness there, indicating that I had found the spleen. So again, I don't anticipate that we're going to notice any splenic enlargement when we move on to the palpation section of the exam, which we're going to do now. So with palpation, we're going to start with light palpation, and this is designed to kind of get a sense of the abdominal muscle tone, get our patient used to our touch for the exam, and then note any tenderness that we'll need to be mindful of as we move on to the deep palpation part of this exam. So I'm going to do light palpation here, again starting in the right lower quadrant. I'm paying attention to my patient's facial expressions to make sure I don't see any signs of wincing or guarding of the abdomen, and I don't see any. Did you have any pain with any of that palpation? Okay, and then we're going to move on to deep palpation. We're going to do this with a bimanual exam. Hopefully they can see that there. Okay, and then similarly though in that, sorry, please let me know if you're having too much discomfort. And in palpation there, seems a little bit tender, or are you just ticklish?
That's ticklish.
Just ticklish on that side, okay. On the left lower quadrant there. Some patients can have tenderness there where the colon lies. So that's a general deep palpation, looking for any masses. If we can feel the kidneys, which I could not on palpation. I did not note the liver or the spleen either on my initial deep palpation, nor did I feel the gallbladder. Now I'm going to do a little bit more focused palpation, deep palpation in the upper 2 quadrants of the abdomen to see if I can find the liver or the spleen or the gallbladder. So on the right side, looking for the liver and the gallbladder. You know, we kind of have a sense of where that lower border of the liver is because we did that on percussion. So we're going to kind of start there, and I'm going to see if I can find the lower margin of your liver. And I can, I feel it right here. I'm going to just palpate a little bit deeper to see if I can feel the gallbladder. Do you have any tenderness there?
No.
The gallbladder sits actually kind of posterior to the liver, and I'm not able to palpate it there. And then I'm going to move on to the left upper quadrant where your spleen sits, you know, closest to the surface if it's not tucked up under the ribs where it belongs. And now when we were percussing, I was not able to find the spleen. And on light palpation, I didn't feel anything, so we'll just see with some deep palpation if we are able to find the spleen here. Can you take a deep breath in and let it out? And I don't feel anything as far as the spleen, so that indicates that your spleen is likely not enlarged and is of a normal size. So that concludes the palpation section of the exam, and we will move on to checking for some costovertebral, any costovertebral tenderness, but I'm actually going to save that until the end of the exam. Since I already have you in this supine position, I'd like to conduct the assessment of some blood vessels while we're here. So we already listened with the bell of the stethoscope to your abdominal aorta, and then the iliac and renal branches, as well as the femoral arteries with the bell of the stethoscope. So I'm going to do the same thing with the diaphragm of the stethoscope now. Thank you for holding your breath. You already knew. You can breathe. That way, take a break in between. listening to the femoral area as well. While we've got you down here, if you wouldn't mind turning your head to the left, I'm going to listen to your carotid artery here to check for any bruise. Good. I'm sorry, if you wouldn't mind keeping your head turned, I'm just noticing pulsations of your carotid and your carotid artery in comparison to any jugular venous pulsations, which I don't see, but I can see the carotid pulsating here. If you would mind turning your head in the opposite direction, please. I'm going to listen for bruise there as well. Good. I don't hear any bruise there, even on either side. Thank you. I'm going to feel your pulses here peripherally. Since you're lying down, it doesn't really matter if you're lying down or sitting up for this part. And I'm going to check on your other side as well. And you've got +2 pulses there in amplitude bilaterally. And the skin is warm and you're looking well perfused all the way down to your hands. Got some purple tinge to your hands there. I guess maybe you've been painting or something. And then we'll do the same thing with your legs while we're here. So again, feeling the temperature all the way down on both legs, warm and well perfused, palpating for popliteal pulses. And moving down to posterior tibialis on the medial aspect of your ankles, as well as dorsalis pedis on the anterior aspect of your feet. And again, we've got +2 pulses bilaterally. Okay, if you would mind sitting up for me now, you can pull your shirt down in the front there. And we're going to check for costovertebral tenderness. So again, if you kind of would mind, angling yourself, that's wonderful there. I'm going to pull your shirt up in the back. Okay, and so we're going to start at the bottom of your kind of costal margins here. We're going to put a hand flat on your back, it's easier for them to see. And then I'm just going to kind of let me know if you're having any tenderness or pain.
Okay.
And we're going to do that on both sides. Any pain or tenderness there?
No.
Okay, great. Okay. That was very nicely done, and with the exception of that that umbilical hernia, really not finding anything abnormal with that exam. That is something you might want to follow up with, perhaps with general surgery, to see if that's something that you need to have intervened upon. Otherwise, all looks well. Thank you very much for your time, sir.
Great, thank you.